session. So I'm moving on with the next set of questions. So let's see the next few questions. So quickly moving on to the next one. Question number 141. A diabetic patient came with sudden pain in buttocks followed by necrosis. So answer to this question was necrotizing fasciitis. Next question. Tap water collection for bacteriological testing. So for this, the answer was water should be collected from the midstream. To avoid spillage, there's another option to let water run for 1 minute, but 1 minute is a little bigger time, I feel. So this would be more appropriate answer. Next question. Meningitis with gram-negative bacilli. With gram-negative bacteria. So to identify that, we could use the property of satellitism. Next question. TB sputum smear. Negative patient. But chest X-ray is positive. Which investigation is to be done next? So answer to this is CBNAT. Next question. A patient from Delhi with thrombocytopenia. So answer to that is dengue. Next question. An HIV positive patient with skin lesions. So there were two questions. One question was with umbilicated papules. So for that the answer was molluscum contagiosum, and the other question the answer was histoplasmosis. Next question. In case of a corneal ulcer, how to detect was using fluorescent dye and cobalt paper. Next question. Baby with bile duct proliferation, pale stools. So the most appropriate answer to this would be Dubin-Johnson. Next question. A patient was on clonidine and stopped it days before. stopped it around 3 days before. Now he has headache. So this is rebound headache. Next question. A patient has great toe pain suddenly. Uric acid levels are normal. So the diagnosis is acute attack of gout. Next question. Alcoholic patient taking aspirin for lung cancer. No, taking aspirin came with hematemesis. And melena. Diagnosis is peptic ulcer. Next question. Indicator of availability, utilization, and development of a place. So this is also a little confusing question. So there was an option HDI. Also there was an option infant mortality rate. So feel infant mortality rate is more appropriate one, but the other option is also equally good. Next question. Years of potential life. Lost, potential life lost is based on. Answer to this is premature death. Next question. There's cataract in a diabetic patient. Next step is immature. It's an immature cataract and phacoemulsification with IOL implantation is to be done. So this is also a little controversial question because other options like rosette cataract and there was one more option which was quite similar, but the diagnosis can be any of them, but the management part I felt this one is more appropriate, so this looks more to be a better answer. Next question. Fluid deficit is risk for. So this is also again a confusing one, and I think the answer is acute tubular necrosis because in case of fluid deficit the kidney will be affected, and so it can lead to acute tubular necrosis. But there are a lot of controversies to this question. So next question. Pituitary surgery is done for a patient he has diabetes insipidus. So what is to be done? So the answer is give desmopressin lifelong. Next question. NMAS method of autopsy. Answer to this is Latule's method. Is the commonest used method also. Next one. Epidemiological study was shown where data was collected from records. So the answer to this is retrospective cohort. Next question. A histopathology slide was given, and that is also a little confusing one. So the answer to that is glomerulus. Next question. An essay subarachnoid hemorrhage patient came with BP of 160 by 100. What is the next management? It's again a controversial one, so I think the more appropriate one is CT angio. Next question. ISPAD protocol for DKA. To this question, the option which had insulin to be started 1 hour after fluids is the right one. Next question. A post-transfusion patient had Krebs. This is due to, answer is fluid overload. Next question. There is decreased sensation in the radial 3.5 fingers. So that is seen in carpal tunnel syndrome. And Durkin's compression test is the test used. Moving on to next one. Question number 164. Cock-up splint is used. An image was given of cock-up splint. It is used for radial nerve injury. Next question. There was a question which had mentioned about pallor proprioception being affected. Pallor positive and stomatitis positive. It appears to be a case of severe acute combined degeneration. Next question. An image of cardiac action potential was given and an area was marked. So that is because of calcium channel opening. Next question. A patient with hypothyroidism and pulmonary fibrosis. Drug he is taking is amiodarone, because amiodarone causes pulmonary fibrosis. Next question. Treatment for chronic pancreatitis. Answer to this is pancreaticojejunostomy. Next question. Loss of dorsiflexion seen in fibular neck fracture. Next question. Temporal lobe hemorrhage is caused by, answer is herpes simplex virus. Next question. Rene's test was positive only for 1024 hertz. So AB gap is, answer is 30 to 45 decibel. Next question. Shepherd-Crook X-ray was given. Answer is fibrous dysplasia. Next question. An image of penis with verrucous carcinoma was shown. Management is partial penectomy. Next question. Spike and dome pattern seen in membranous type. Next question. Cola colored urine and pyoderma associated with, so these two are associated with, answer is subepithelial deposits. So thank you guys.